Charlie, you know, one of the things I love about your program is that when you bring patients into the practice, you're pre-educating them, but it's also happening in a group format. What sort of, you know, when you do your dinner talks and you're bringing people into the practice, what sort of benefit do you think it adds to the practice to be able to, you know, sort of put patients in a room with other people who are just like them right from the start?
Yeah. Well, again, I mean, this is the way I built my practice, and it worked for me, and it's worked for 250 clients since then. You have to look at, as physicians, practitioners, we're constantly repeating ourselves. We're trying to teach 52 lessons over a course of time, covering everything from understanding their blood work to gluten to vitamin E, to you name it. And we have to learn that we've got to start presenting that in classroom format, because it takes the time off the physician, so you can actually help more people. You can actually see your family and your kids, not work on the weekends. But it's also helping those practice members, because in group format, they also realize they're not the only one there. There's all these other people looking for the same help. And they know that I must be in the right place. Look at all these people here trusting this, and they support each other. All the time, we would get members begin to work out together. They would find a friend. If they were struggling on some of their diet, they would get suggestions. Even though we had cooking classes, we had things like this, people would offer, they would bring in, hey, I've got all these different recipes that I've done, you want to share these with your clients. So it's camaraderie, and I see that all across the board, but primarily women especially, and women are typically the first people that come to the practice, then they drag the husband in, right? So they love this group activity, and so it was just a plus all the way around for the practice and for compliance. Everyone loved it.
Awesome. Okay, so get ready with your questions. We got time. If you have a question, put your hand up, and I'll come around and I'll give you the mic. And we've got a very good-looking panel of health professionals here. Dr. Thompson, you know, you've made a real push in your practice to integrate with the rest of not just the integrated medical community, but also the medical community generally. What are some of the biggest sort of opportunities for dentists to sort of play a more proactive role in the whole community, given the clinical need and all the different areas that you've already spoken?
I think probably the two biggest opportunities for dentists is to really hone their skills on the early recognition and management of periodontal disease. And then the other thing would be patient airway management. Starting to identify people who are having problems sleeping, who are having problems, again, not getting a restful sleep. And what that does is it drives inflammatory biomarkers up, and it puts these patients more at risk. So we know through really good proactive care, either in periodontal disease management or other areas, we can save that patient thousands of dollars in future medical costs. So a lot like what we were talking about earlier in intercepting these diseases early and identifying them early. You know, I used to not have a lot of confidence in what I did, and then when I realized, you know, you don't know who the healthcare provider is going to be that says something to a patient that either changes their whole trajectory toward health. It could be exercise, it could be hydration, it could be nutrition, it could be a lot of things. So we've created a group of wellness-oriented dentists. And I want to give a shout out to Ed Borio and Nancy Hartrick. They're in the house here from our local area. But we have a nice network of people that are looking to bring wellness concepts into dental practices.
Awesome. That's so good. And yeah, look, as I said, again, if you're a dentist watching or if you're a Functional Forum meetup host, call the dentist, get them in, because I've yet to meet an integrative dentist who's not packed to the rafters. I mean, it seems to me that in all of these fields, the demand is outstripping the supply really, really quickly. You know, you know, Mark Hyman needs a I see like the list of jobs